Welcome to Apply Wellness with Wendy on negativeionclothing.com. And my name is Christina, and the health talk this week is on thermography. And I was actually at my annual checkup a few days ago, and my doctor recommended that I get the mammogram. I mean, for women, I believe 40 and up, we should get it at least annually or once every couple of years. And but then one of the things that came to my head was that, isn't that X-ray? I mean, that's X-raying parts of our body. So I'm very conscious about anything that's could be not beneficial to my body. So, and I had a conversation with Wendy, and she had brought up breast thermography. So I'm very curious because I really want to learn more about this topic. So I want Wendy to enlighten us with what really is breast thermography and how is that different from a mammogram?
Okay.
Hey, Wendy.
Well, basically, thermography is digital infrared imaging. Okay, so there's no radiation. It's not painful. And what it is telling you is different than a mammogram. Mammogram is telling you about your anatomy, and thermography is telling you about your physiology. So I'll explain that more, but the problem is that mammograms are not 100% either accurate or finding everything. Physical exam doesn't 100% find everything. And thermography doesn't find everything. And anybody that has problems with their breast or any other part of your body, you're wanting as much information as you possibly can have, and you want early detection. And thermography is not as effective on early detection because it's not addressing physiology, which can be happening earlier before it anatomically and anatomy-wise shows up on a mammogram. So you're going to have cells be changing and mutating, and the size of them can be quite small. It will not be detected on a mammogram. But thermography, because it's showing heat patterns, and not all, but a majority of tumors are heat related because their blood flow is going into them. And the more blood flow that goes into an area, the hotter it gets. So like when you run and your blood is pumping, right, you get hot. The same with the area of tissue. Cancer wants more nutrients, it steals, and so it keeps making more vessels, more circulation to go to that area. And as it gets larger, the area gets hotter. That is the majority of tumors. Some tumors are not heat sensitive, but the majority are. So it gives you another tool for women. Not that men can't have breast cancer, but most of the breast cancer is with women. And 1 of 8 women are gonna, in their lifetime, experience a degree of breast cancer. So it's just beneficial to have more tools. The other difference between mammogram and thermogram is that mammograms have trouble with certain types of breasts. Like if the younger you are, the more dense and fibrous your breast is. And so sometimes it doesn't read it as well. Okay. So in fibrocystic breast disorders, people that are on hormones can have a different texture of breast. And so then it's not as easy for a mammogram to read. And very large breasted women are harder for the mammogram to read. So it just gives another tool for women that are wanting, to be read and maybe not have have different issues with their tissue that's not as easy to read with a mammogram.
Okay. So what I'm hearing you saying is that mammogram and thermography is really, we should use them complementary to each other. So Absolutely. It's like you say, it's another tool plus the physical exam to make sure that we can keep our breasts healthy, and then also to ensure that if there's any abnormalities, that it could be detected early. Correct?
Absolutely. Correct.
Okay. Wow, that's good to know. And actually, it's amazing to hear what you're saying about the technology behind it, which is really based on heat. And tumors are feeding on nutrients and is drawing blood to a particular area. So is it applicable not just to breast, or can it be applied to other parts of your body, or is it primarily this technology is only applying to breasts?
It can be applied to others. The practices I've worked with that used it applied it to thyroids when they get inflamed, because inflammation tends to get hot. And so if your thyroid is inflamed, if a man's prostate is inflamed, and what's important is that that you establish a baseline. So generally when you get a thermogram, 3 months later you get another one, so that you can kind of see this is what you are, and then if there's changes occurring, you'll see those, because everybody has like a thermal fingerprint. Just like you have a fingerprint on your hand, you have a thermal fingerprint. Excuse me, let me get that. You have a thermal fingerprint, and then doing that, it allows them to have a baseline determined for where you are, and then to be able to monitor changes, and also to know how often you should be followed up.
Okay. So it's almost similar, like if you were to get a mammogram, they take year-to-year comparison to make sure that nothing's changed, right?
Correct.
Yeah.
Correct.
Okay. So, so what is the procedure like? I mean, it sounded like it's a camera that kind of, or some equipment that detects the heat. But what can a person expect the procedure to be like if they were to go into to get a thermogram?
Well, basically, you would go into a private room and you would disrobe, and whatever part of your body, we're addressing, breast at this time, you would take your gown down so that your breasts are exposed, and then a digital camera is taking a picture. It does not have physical contact with your skin. It's taking a picture. If you Google breast thermography, you will see what the pictures look like. So it's not, an actual physical picture, physical picture where you see flesh. You see red areas, you would see green areas. Things that are cool would be on the green end, yellow is in the middle, and then red and orange is hot. Okay. And breast, because it's predominantly made of fat, tends to be cooler. There's not as much vascular there, and so it tends to be
an image that's more cool.
Right? Yeah, so it's usually more in the green, yellow, cooler, and then your body, like up on your upper chest, it's not as fat, and so it tends to have more heat when it's normal. And so that basically, when they take pictures, that's what you're going to see is colors. It's going to be colors of heat patterns on your body.
So that sounds actually relatively painless compared to a mammogram.
Yes, there is no smashing, and there is no radiation. Okay.
Yeah, exactly.
Yes.
Mm-hmm.
Okay, and it's relatively quick. It's not hours to take the pictures.
Okay. So you were saying that if they interpreted the printout and there are some let's say abnormality, then they would recommend taking the picture again 3 months later, right?
They recommend that you take the 3 months later for everyone, so that you can establish a baseline, and from there it would either be annual thermographies, or if they saw a problem and you wanted to monitor this, or suggest lifestyle changes so that this can be addressed, then that way the person isn't thinking, oh my gosh, there's some red areas on my breast, and then they have to wait a year to find out, is it getting worse? If there's changes in the 3 months, then you would say, okay, we need to monitor this. Let's do another one in 3 months, but let's do dietary changes or lifestyle changes. What can we address that can make your body less inflamed? Okay, so everybody would have a baseline, and the baseline is determined by an initial and a 3 months later.
Got it. Okay. So now, is this procedure FDA approved?
It is approved. It is approved as, and I forget which year it was approved, but it's approved, but it's not a standalone.
Mm-hmm.
It is a tool that is to be used in conjunction with other, like either mammogram, physical exam. It's to be used in conjunction with other methods. It's not a standalone. It's to be added to.
Mm-hmm. Just like you said, it's another tool
Right.
to put a more complete picture of your
Right.
health. Mm-hmm.
Yes.
Got it. Now, is it costly to do something like this?
Generally, it runs around $100. Depends on the thermographer.
I mean,
And
a thermogram. That's what I meant. Mm-hmm.
yeah. So thermograms are not covered by insurance.
Mm-hmm.
Okay. The mammograms have like the corner on the market with insurance companies.
Right.
But thermograms, you do not need a doctor's order. So if you want to use this extra tool to put your mind at ease, to have a baseline so you have more information on your health, then you can, Google breast thermography in your area. They will list all the different, locations, different doctor's office. Pick one that's, close to you. It's even listed on Yelp, so you can have, responses from other, clients on how they were treated, what information they received, how helpful it was. But it generally runs between $100 to $150 is the general ballpark for a so years ago the high was 125. I would say now the high would be more, the high would be 150, and we're in Orange County, so things tend to be more money.
Mm-hmm.
But that's it's out of pocket, it's not insurance covered.
Uh-huh. Now, is there a I guess a certification of the facility that you should look for? Because Yelp would give you really good, maybe, perspective in terms of user feedback. But then what is another thing that we should look for before deciding on a place to do that?
Well, to be a thermographer, you have to be certified, and the machine is very expensive. And doctors are not going to risk their reputation having an expensive machine and having an unqualified technician. So you could always ask to see the certification of your thermographer. Thermographers learn how to take the pictures accurately and to look at the pictures before they send them in to make sure they're clear. But they are not the ones that generally read them. They tend to send it in and submit it. Different companies have a board of doctors who have been looking at thermography, so they're familiar with areas of concerns, comparisons. It's kind of like you have a radiology technician who's taking pictures, and then you have a radiologist who comes and reads them. And not that a person who's taking pictures all the time wouldn't start to pick up on the differences and kind of recognize a break or something that's really abnormal, but they're not licensed to actually read it and give interpretations. So they would be sent in, and then the panel would be looking at them, the doctor panel, and then they would give a printout and then their recommendations.
Okay, so it's almost similar to going to a lab and getting X-ray, and then oftentimes I guess the normal procedure is for them to send the report and possibly even the copy of the X-ray to your doctor. So is that something that's also done when you get a thermogram, that you could request, I guess, right, to send it to your primary care doctor as another point of reference for them to help determine your health?
Yes.
Okay.
So you get a report.
That's good. Yeah. I mean, this is very fascinating to me. I mean, I had no idea that there's another tools out there, and this is really enlightening. So now that we kind of understand that, what are some of your advice as a healthcare practitioner in terms of what we should do to actively prevent cancer, or breast cancer specifically, since we're talking about breast health?
Well, it's pretty well known now that the root problem that feeds all kinds of degenerative and cancers is inflammation. So basically you need to look at what do we do and what is contributing to inflammation in our bodies.
Mm-hmm.
And as a healthcare provider, you look, and the majority of those are just lifestyle habits. Those are being, hydrated versus dehydrated,
Mm-hmm.
rested versus sleep deprived,
Mm-hmm.
stressed versus calm
Mm-hmm.
in your brain, not having your overwhelm. Surrounding yourself with alkaline environment, nature is very calming and anti-inflammatory. What else would alkaline foods? I'm a nutritionist, and so I always address what are we taking in, and because we eat usually a minimum of 3 times a day, what are we putting in there? Are we putting in things that are inflammatory, or which are on the acidic side, or are we taking in enough alkaline ingredients to be able to calm? Because it's the normal, what people need to understand is to live and to function, you're going to produce a degree of inflammation. What you want is the body is always balancing, and so you're wanting to take in and surround yourself with things that calm that down. So if I talk, if I walk, if I breathe, if I digest, all those in the process, kind of like a car or a fireplace, they produce heat, they produce ash, they have acidity, inflammation, and so you're wanting to clean that up.
Mm-hmm.
So,
I think we need to, I know inflammation is a big topic, and that's a topic that I think we need to do another call on, just specifically on inflammation, because
yes.
I think it's, there are a lot of, discussions about it, and we want to educate our users, our readers on the site on really the basics. What are the things that they could incorporate in their daily lifestyle to start reduce, chances of inflammation.
Yes.
Yeah. So how does negative ion, and specifically negative ion clothing, that could help with our body health then?
Well, because of all the other things that I was talking about that are literally taking and reducing inflammation, they're creating an environment of alkalinity so that your body, and it's being active and produces acidity, it can be kept into balance. And so when you take a clothing that has been proven by wearing it, it is creating a balance of acid to base, and there's a little window for humans that is ideal, and that's what it's helping do, is it's making the acidity decrease, and so that your body is alkaline and less inflammation, whether you wear it on your neck, or you wear it on your breasts, or you wear it on your your abdomen. If you had intestinal inflammation, that is the friction of the alkaline clothing, the negative ion clothing against your skin, is changing the physiology to become more balanced.
Yeah, because negative ion is alkaline forming, right?
Yes.
Versus, positive ion, which is the opposite of it, or another term that we call it is the free radicals. And that is acid forming, or could be causes of the inflammation that we talked about.
Absolutely. You stated that well.
Thank you. Well, this is enlightening, I think, in terms of, I hope that it's helped our viewers understand more about breast thermography, and as another tool to, another tool in your arsenal of weapons against anything that could be detrimental to our health. So thank you, Wendy, for this information. And if you have any questions or comments, just feel free to enter it below, and then we will get back to you on your questions. And we look forward to another episode soon with Applied Wellness with Wendy. And it very likely might be on inflammation. So look forward to that episode. Thank you.
Thanks, Bye. Bye-bye.
Wendy.